Welcome back to the show. This is Health and Wellness with me, Shiko Kaitani. We're having a great time with the lovely Faith Okwayo. She's the chairperson from the Chronic Disease Society of Africa. Also looking dapper this morning. I'm loving the look. I keep telling her, by the way, I can't get over her dress, by the way. Faith, welcome back.
Thank you so much.
So as we talk about the burden of chronic disease, remember we're also a solution-based program, meaning that we want to tell you what the Chronic Disease Society of Africa are doing for individuals with chronic disease. It's very important to understand where is all the support and the access to healthcare coming from. So we'll jump into that and also understand some of the collaborative efforts that are out there that you can also plug into. It's also important. These non-communicable diseases, as Faith put it, are actually what are silent killers today. The cancers, the diabetes, the obesity, okay, and the numbers that we're dealing with. It's pretty worrying to understand. So when you hear the term NCDs, you know this is really, really important because you can't see it, okay? The cancer is there, the diabetes is there, you can't see it. So what next? Okay, taking a look at your feedback. Hala Masanti Sana for tuning into the show. You're going to say that, hello Shiko, chronic diseases are surely preventable. People just don't realize that garbage in, garbage out. It is poor lifestyle choices and our disregard for our planet making us sick. Wow, what do you think about Harlem?
Wow, that is a bold statement.
Right.
However, there's, of course, a margin of error because not all chronic illnesses are necessarily because of garbage in, garbage out. Some of them, like we said, even the WHO has stated that they are genetic, physiological, and environmental factors. So it's not all about food. However, there's also food addiction in the society. That, you know, is a dopamine issue, and that's why we need to educate the patients on how to reduce the food addiction, how to manage, so that they can be able, because sometimes food addiction is even caused by the substances in the food that we cook.
And they do it intentionally to make you keep coming back.
So that you're addicted to it.
Right, the chemicals that are being used in the food, cause the addiction.
Yes, I love that. Yes. So even the vegetable oil we keep using.
Yes.
Okay, there's so much misinformation and mistruths in the society. The vegetable oil we keep using to fry our mandazis, to make our chapatis, that is what causes chronic illness, not even the alcohol. However, alcoholism is a whole other topic because it's also a chronic illness.
I like what you said because she was cracking me up during the break. She's like, do people think when you just drink and smoke, that's what gets you to get your chronic disease? No, even the mandazi can kill you.
Yes. Even mandazi, even rice,
even
anything
rice,
white on your plate can easily lead to chronic illness. And that is just, it's a very complex mix of what you eat and every other factor.
I can't wait till we have that discussion in an upcoming day. Today is just an overview. It's just an overview. But we're going to go deep with Faith very soon, okay? And actually start challenging you about what's on your plate. Okay, Annie Southby, good morning, darling. You go on to say, always watching K24. Woo! Thank you. You go on to say, thanks for the teaser. Perhaps ask your panelists how each and every one of us can play a role in reducing the burden of chronic disease today. What can we all do?
The first thing is, first of all, to empathize with those who are already sick and support them to access the help they need in terms of linking them to care, having a proper referral pathway. And next is just drink your water, have your brisk walks, do the bare minimum. What you can do for yourself so that you can support others is to take care of yourself. So drink your water.
I'm following instructions.
Say this. There's nothing like too much water. The more the water, the better, because of the churning of the toxins. Yes, drink your water and stay active.
Then stay active. Kasavuli, I'm drinking my water. Are you? Okay. Lucky Degwa from Nakuru, good morning. You're going to say, more effort has been placed towards fighting your infectious diseases such as HIV and TB. The messaging is everywhere about protecting yourself. Where are the campaigns about cancer, diabetes, and high blood pressure? They should start putting these up in social joints to remind us what's coming up should we fail to take action. I actually like that. Loki is like, yes, put posters up in all the Nyamachoma joints. Can you please put a poster up and be like, what are you doing? Okay, why are you here every weekend?
Yes.
Ukikula nyama choma. Are you aware what's waiting for you?
Yes.
I like that.
Yeah, I like that.
Yeah, scare people into action. But this actually brings us to our next point. And to be honest, messaging is key. The campaigns are key. So what are we doing in terms of the awareness, Faith? Like, what more needs to be done so that when we talk about how fast the communication is around infectious diseases like HIV, you remember how it was back in the 90s, in the 80s. There is nowhere you would turn and there wasn't something about HIV awareness. What can we do so that we are slapping people in the face with diabetes campaigns, cancer campaigns? Yeah.
So as Chronic Disease Society of Africa, we have so many initiatives. And to mention a few, we are partnering with institutions that are already in the healthcare industry. Remember, we have about maybe 13 to 15,000 doctors in Kenya against the population of almost 60 million. So they're already overwhelmed. So the first action is to support the healthcare system and not to vilify it, to support it so that it can have that fluency of engagement.
All right.
So we are, as Chronic Disease Society of Africa, we are partnering with every level 4, level 5, and level 6 hospital to establish patient education centers.
Yeah.
So that now post diagnosis, the patients can have somewhere to go and cry. You see, like when you go for VCT, you have that 1 hour of counseling and then that information and awareness and reduction of that stigma. So already there's also stigma in diabetes, the stigma in cancer, the stigma in chronic kidney disease, the stigma in arthritis, and you are always constantly in pain, and there's that level of inflammation. So you might not know how to handle yourself. So you need that level of support, first of all. So we have established a lot of patient support programs in partnership with our counties to start there. The next is partnering with, of course, education system, the KMTC and the universities that are training healthcare practitioners so that they are empowered and enabled by the time they are graduates to know how to even do early screenings and early detection.
Right. Fantastic. This brings us to the point of now understanding about a little bit of the structures that you have put in place. You had called them, okay, fine, I called them pods. Yes. But I like the idea of you grouping people based on their region, right?
Yes.
And so for me who's watching this show, maybe my mom is, dealing with diabetes and I'm in Kwale, or there's somebody who's watching right now and they're in Lodwar. So when we talk about these little pods that are around, how do they work? How do they function? How does someone also just say, okay, I want to be part of that, but I don't know where to go?
Yes. So we are creating visibility.
Okay.
And of course, also it's very personal and private to be sick. Not everybody wants to share. So we have created ethically maintained groups within every sub-county.
Okay.
To be able to call members, and also there are different disease categories with different needs. So we are doing a lot of disease penetration. So in these small groups, they are led by our doctors, our clinicians, our community-based health workers, and they are guiding patients on what to do on the next steps and how to do what we call self-management at home post-diagnosis, where to access the cheap medication. We even negotiate for better lab, because most people don't get detected because they do not go to proper labs, or they go to labs that are ill-equipped, and the labs also need that empowerment so that they can do proper screening when patients go there.
Correct.
So just referring these patients to the right labs, referring these patients to the right pharmacies where they can get proper, good medication, because there's also a lot of influx of, I dare say, counterfeit medication. Yeah, we need to reduce this. So advising our patients on best practices is what we do by putting them in the small groups of up to 20 people within every sub-county based on disease category. This will also help us understand disease population, to inform policy on how to manage better in whatever regions.
And this is why you were talking about why the data matters. So research also needs to be equally funded, together with the preventative programs that you have on ground and the, and the management programs. Because if we don't have the data, we don't know what we're looking at. Is that the situation?
Perfectly said, because R&D, research and development, is the only thing that leads to new like let me say new disease treatments and all that. So in Africa, the reason why we suffer so much is because we don't have any data that is reliable. We don't have any data that is ethically obtained. So we've created this institution that has ethical observance and is already underscored within the data collection observance programs, so that we can use this data to enable the government to plan better for these diseases.
Correct.
So we are collecting this data to improve research, to improve pharmaceutical equity by our patients being able to be exposed to clinical trials, because you know the genomics differ. In Africa, we get medication from other markets that have not been tested on ourselves. So we don't know. Cancers are very variant, and it's so hard to even understand cancer as per the black body. That's why the mortality rate of cancer in Africa is so high. It's almost 99%. Because studies have not been done within ourselves, because we get even diagnosed at stage 4 when we are already dying. So who is there speaking for us and taking care, making sure that we are taken care of?
Absolutely. This is so vital. And you guys really do have your work cut out for you. And I mean, when I just think about it, honestly, it is such a gigantic mission, you know, that you have, being able to actually collect all this information. But even as we start to wind up and of course get your final remarks, let's still listen to what Kenyans had to say in regards to chronic diseases.
In lifestyle, if you you don't do exercises, and also your diet, the way you eat,
Is there a certain age group for the chronic diseases to attack?
I don't suppose so. You'll likely get that disease because of how you just carry yourself. So be it you're a teenager or an adult, you're open to get these chronic diseases. It's just for you to be careful.
Before we could hear that most of these diseases were only attacking the aging population. You know, where the aging population 65 and above, the youthful population. But nowadays, I think most of these diseases even they can even get this youthful age, even the children, because there was a time also even my own brother, he had got pressure, but when we went to the hospital, he was asked, "But you are still young." So from that day, I also have a cousin who is also having arthritis. The cousin is around 22 to 23 years. So I think nowadays the disease can get up with everybody. There's no age bracket.
I think it's general. Nowadays, anybody can get cancer, high blood pressure, diabetes. I think this is now a problem that affects almost everyone, from babies to old people.
Mostly because according to my observations, when one is young, actually many times you don't feel, you feel healthy, you feel very apt. But as one grows, then you find that there are many other diseases coming up. Mainly mainly cancer.
It doesn't mean so, but as the statistics are, larger percent of those people who get the lung cancer or the throat cancer is gotten by those people who use cigarettes, and also by those also growing cells on the kind of chemical, because some of these soft drinks that we consume, they are also made of chemicals. So it can also cause the throat cancer and the lung cancer. But kids, according to my own thinking, I don't think they can obtain more lung cancer because they don't involve themselves with cigarettes or drugs.
Thank you so much for your feedback.
Hi, thanks so much to the team who went out on ground just speaking to Kenyans about chronic diseases and how much we understand as the public about them. Faith, just picking up on a few things there and, you know, on what some of the individuals said. I mean, they're not obviously specialists, but people have an idea about, you know, where we're headed and what the situation or the causes of these issues are. But I want you to stress our next point to the younger audience watching, that we should also care. It doesn't matter if you're a 23-year-old watching this show. Why should you care about chronic diseases? And why should you be bothered? Because like someone said there, we always used to think this is something, you know, when you're up in age that you can concern yourself about when you're older. Why should I care now?
Because chronic illness is not what you think it is. It is very, there's a myriad explanation or myriad categories of chronic illnesses. Most people think it's just heart failure or just diabetes. No, there's so many. We have depression as a chronic illness, substance abuse as a chronic illness, and this is affecting young people, and even Facebook addiction. I'm not saying the Facebook addiction is a chronic illness, but addiction in itself is chronic. And young people, okay, there's a lot of penetration, digital penetration, and young people have grown up in the digital age, and they might not know when their dopamine is being elevated by just a certain addiction, and that addiction alone can make you now have chronic illnesses earlier than you should. So yeah, there are so many reasons they should care, and also we are all somehow gonna die from a chronic illness.
Whoa, so guys, si wazee pekee wanaenda. Okay, did you listen to that? People as, you know, in their 20s with arthritis, people dying of cancer at the age of 28, 30. It's really sad to even just see how we're losing so many people. But anyway, time is up, Faith. I want you to actually give us your planner. So what are your organization's key priorities? What are going to be your goals going forward?
So our key mandate is to prevent these chronic illnesses and to support those ones already diagnosed with it to manage it better. So we are narrowing down on visibility and surveillance of the disease. So early detection is our core mandate, increasing vaccination for the diseases that can be prevented, and now increasing access and affordability of medication for diseases that have already been diagnosed, and just supporting the healthcare ecosystem and supporting the government where we can, and also asking for government engagement and support in our processes.
All right.
Yeah.
All right, let's wish you all the best on that. Last but not least, for those who actually want to engage further, look up more on the organization, especially when it comes to those, you know, those pods we're talking about. How can people actually reach the Chronic Disease Society of Africa?
So we have our website, www.cdaafrica.org. There you can be directed to our local offices and our local point of contact people. Yes.
Fantastic. Thanks so much, Faith, for making time this morning. We appreciate your company. She is the chairperson from the Chronic Disease Society of Africa as we discuss the burden of chronic disease. Remember, we are just scratching the tip, okay, of that iceberg. We're going to be unpacking more in the coming weeks with Faith and individuals who are experts in this space, because like we said, we each have a responsibility. We may not be the experts, but we can provide the experts to actually spread the gospel, okay? And so with that, we hope that this particular segment was informative. If so, why don't you let us know through our social media platforms. Again, if you always need a contact and you feel that, by the way, I missed that, go straight to my DM as Shiko Kaitani, which is SHIKOKAITTANY. Send me that DM. I'll be sure to actually link you up. Let's leave it there as we have the dynamic duo, obviously, of Tony and Sarah coming up next for the next 1 hour as they get interactive. See you tomorrow. Bye-bye. Thank you, Dan.